Okay, great. Yes, let's start. Good evening, ladies and gentlemen. Welcome and thank you for joining us tonight. I hope it will be a rewarding evening for you. Tonight, I will try to share my experience and know-how on laser devices and especially CuRAS from a plastic surgeon's perspective. Let me give you some info on how we will proceed tonight. My presentation will last about 40 minutes, and in this 40 minutes, I will start by sharing my basic thoughts about lasers and aesthetic medicine. Next, I will talk about technical information about the device, which I will keep it shortly. And after the treatment videos, I will finish my presentation with the patient before afters. Please ask me questions using the chat screen during my presentation, and I will try to answer them all after the presentation. Because the more we discuss, the more we understand and appreciate the technology, because they really are game changers. So let's share my screen and start the presentation. Yes. First, let me explain why I called my presentation a plastic surgeon's perspective. In Turkey, there are three groups of doctors who use lasers for skin treatments: plastic surgeons, dermatologists, and medical aesthetic doctors. And as we all know, every medical specialty has its own perception of diseases and also treatments. For example, while I prefer a surgical excision for a skin lesion, a dermatologist may choose cryotherapy, or a medical aesthetic doctor may prefer lasers for the treatment of the exact same lesion. And that's why I referred my presentation as a plastic surgeon's perspective. First of all, let me introduce myself. My name is Toygar Ünveren. I'm a plastic, reconstructive, and aesthetic surgeon in Istanbul, Turkey. I have a private clinic in Istanbul, and I mostly do surgeries in my practice. But of course, other than surgery, I also like doing minimal invasive and non-invasive procedures such as Botox, fillers, and of course, laser treatments. To be honest, at the beginning of my career, I was a little bit skeptical about laser treatments. I was not sure about using lasers because of probable unpredictable results. But now, I have banner ads of laser treatments all over my clinic, because they are really valuable tools for my practice. This is the video of my clinic, actually. Now you're going to see my operating room. As you can see, the lasers are just waiting there, because I also use them during the operations. And you can see the CuRAS banner ad is just at the here near of my door. When I did a little research, I realized that there has always been a great interest in beautification throughout the history. People were always looking for a solution for aesthetic problems such as overweight or deformities of the nose, or skin problems like hyperpigmentations. And various masks, dietary supplements, topical creams, and even strange methods have been tried to treat these problems. Non-surgical aesthetic procedures have always been very popular, but with simultaneous advances in technology, we are witnessing an even more rapid increase in its popularity. Because of this popularity, medical sciences have been evolved rapidly in the last century, and it keeps evolving today with even faster pace. As medical science evolves, patients' perspectives on treatments are also changing. Today, non-surgical methods are the new trend. In the past 10 years, there was a decrease in the number of patients who prefer surgical procedures. I see this in my patients. But the interest in minimal invasive and non-invasive procedures increased significantly. It's an evolution we are witnessing right now. And in the natural course of life, those who cannot keep up with the evolution cannot survive. So we have to adapt. But adapt how? Due to the power of marketing and social media, we are hearing hundreds of new treatments, new devices, and products every year. The problem is that only some of them are effective and safe. But The patients believe what they hear. And every week, at least one patient asks me, have you heard about the new treatment? Are you going to do it to me? While adapting to the minimal invasive era of aesthetic medicine, we should not compromise safety and efficacy in our treatments. Therefore, we must be careful before using a new treatment method. First, what we have to do is decide what we need for our practice. Then we have to do some research and find the right products that suits our causes. And afterwards, we have to contact and talk to the manufacturers, the distributors, and of course, we have to try it before we buy it. Right now, I have two lasers, Fraxis Duo and CuRAS at my clinic. When I combine my surgical skills with my lasers, I am able to treat almost every problem that I encounter. And I think that should be the goal of every physician. You must have the right products to deliver the treatments you want. And with the proper instruments, almost every problem has a solution. And this is where Creative ilooda steps in actually. I first met Creative ilooda in 2015 actually, in an international plastic surgery meeting in Istanbul. I saw the Fraxis Duo there. I talked to the distributors and I bought one Fraxis Duo several weeks later. After I bought and used Fraxis Duo for a while, it became an indispensable tool at my practice. It provided me new treatment options for the patients and helped me to treat the problems that I was not be able to solve before. After being so satisfied with this laser, I've contacted the local distributor to find out the other devices of Creative ilooda, and I bought CuRAS afterwards, which actually made my private practice a whole. These are good devices. Technology is of course very important, but it is the reliability and the credibility of the company that sets the real value of the device. Please let me tell you an experience of mine with ilooda. I find it very important actually. It was about a year after I bought CuRAS. I felt that there was a slight difference in the sound of the cooling system. I called and told the local distributor about my concern. About a week later, a Korean team came to my office around 9 a.m. They dismantled the whole machine, examined and changed some parts, and assembled the device again, made some calibrations. They showed me that the device is functioning perfectly. They worked the whole day without a break. And they did all this for effort just because I had some concerns about the machine. A week after they left, I told that the sound was still there, and they didn't even ask me a second question about it. They just sent me a brand new CuRAS and take the older one for further investigation. I will show you CuRAS is a very powerful device, but as I mentioned before, it is the reliability of the company that sets the value. Without the right manufacturer and the right distributor, the quality of the device is not important at all. As you can imagine, as a surgeon, I love to do surgeries, but sometimes I face a problem that I cannot solve with surgery. For example, I can't treat a patient's age spots or create a better skin quality with a facelift. Or I can't treat a patient's scar with a surgical intervention. For treatment of skin-related problems like those ones, Fraxis and CuRAS are both very powerful and safe instruments. So today's topic is CuRAS, so let's put Fraxis aside and talk about CuRAS a little bit more. CuRAS is very successful with cafeola stains like this one, and also other hyperpigmentations of the skin. The basic, CuRAS is a Q-switch Nd:IAG laser. It is mostly used in the treatment of natural and artificial pigmented lesions, such as tattoos. But it can also be used for quick skincare, hair bleaching, skin toning, and onychomycosis treatments. CuRAS comes with 3 different 10 pieces, which can be used for different purposes. I will also explain them in the next slides. Here's the general overview of the device. You can see the laser source, wavelength, operating mode, pulse energy, etc. I will try to explain most of them in my presentation. But the main question, what is a Q-switched Nd:YAG laser? To understand this, first we need to learn what does Q-switch and Nd:YAG laser means. Q-switching is a very advanced and complicated technology, but basically we can consider it as a method of energy delivery. In the devices with Q-switch technology, the laser energy is not continuously delivered to the tissue. It is accumulated in the device for a while, and when the switch activated, a high energy pulse is delivered to the targeted area in a very short time, such as nano or picoseconds. While delivering high energy to the tissue enhances our treatment efficiency, doing it in a short time decreases the peripheral damage and complication risks. And what is Nd:YAG laser? Nd:YAG laser is one of solid-state lasers using neodymium-doped yttrium aluminum garnet crystal as its energy medium, and it radiates through wavelengths of 1064 nanometers and 532 nanometers. What are the differences between these wavelengths? The main difference is the penetration depth. 532 nanometer wavelength has lower penetration depth. It is useful on epidermal or superficial dermal pigmented lesions, and also you can remove red tattoos with this wavelength. 1064 nanometer wavelength has a higher penetration depth, which makes it useful on deep dermal pigmented lesions treatments. It is also safer in patients with skin type Fitzpatrick 4 to 6, and also you can achieve better results in dark colored tattoos such as dark blue, black, or brown. With 2 different wavelengths, 3 different handpieces, and 6 different pulse modes, you can treat various kinds of skin problems with CuRAS. I just talked about the conventional 532 and 1064 wavelengths. There are 4 different pulse modes. The first one is, PTP 1064. PTP stands for photoacoustic twin pulse. It is a unique laser emitting mode in which double pulses are delivered within one Q-switching cycle. We use it mostly for hair bleaching. You can use it for pigmented lesions, but mostly hair bleaching. The other one is FR 1064. FR stands for free running mode, and we can make collagen remodeling, skin tightening, and melanoma toning with this mode. This M1064 is for melasma treatments, which I will mention in the next slides. And the last, A1064, is exclusively for onychomycosis treatments. This slide is actually very helpful. It helped me a lot to understand. These are the pulse types. As you can see, in conventional single pulse, we have a very high peak energy within a very short period of time, such as 5 to 20 nanoseconds. And in PTP mode, we got 2 identical pulses in the same period of time, 5 to 20 nanoseconds. But notice that the energy peak is lower than the single pulse. But what does it make in clinical use? Less energy peak means less thermal injury to the surrounding tissue. And also in multipulse, as you can see, we have got 7 pulses in 100 nanoseconds, also with lower energy peaks. Let's look at multipulse mode a little bit deeper. As I mentioned, we also have lower energy peaks with M mode. However, considering the duration, the total amount of energy produced is higher than The standard mode, as you can see here, is 600 millijoules and 1.5 joules here. Giving high amounts of energy to the tissue with low energy peaks allows us to create more damage to melanin without increasing melanocyte stimulation. This is especially important for melasma patients. Here's a good example. At the top, you see a patient with a melasma who treated with M1064 multi-pulse mode. As you can see, a great result was achieved. But when we look at the patient in the bottom, who is treated with Q1064 conventional mode, showed that the melasma got worsened, even worsened. What is the difference? The main difference is the energy peaks. Higher energy peaks creates more melanocyte stimulation, so we have to be cautious when we are choosing our energy mode. About other modes, FR free running 1064, it's a long pulse mode with high thermal energy up to 300 millijoules with a speed of 30 Hz, which stimulates fibroblasts in dermal layer to induce collagen production. We can use it in soft peelings, acne treatments, reducing large pores, and also skin whitening. And the last one is A1064 mode, which delivers high thermal energy up to 300 millijoules in order to treat onychomycosis. Here are the three different handpieces. The first one is zoom. You can change the spot size with this zoom handpiece, which gives you the possibility to adjust your treatment just with the handpiece. As the spot size narrows, the amount of energy delivered to the targeted area increases. Pigmented lesions are treated with this handpiece. Actually, it is the universal handpiece and you can use it in every mode. The other one is a fractional handpiece, which has a fixed spot size of 7 times 7 millimeters. We're using collagen remodeling, skin tightening, melanoma toning can be achieved with this one. And the last one is the collimated handpiece. It also has a fixed spot size of 8 millimeters. And with this handpiece, we are using it mostly for melanoma toning, soft peeling, and carbon peeling. So how does this work? When a high energy is delivered to the tissue, the targeted melanin breaks into fragments. Doing this in a very short time also causes decreased collateral damage to the surrounding tissue, as I mentioned earlier. After, the melanin fragments are eliminated as waste from the body through lymphatic system. And these are my main indications in my practice. Patients with pigmented lesions are the majority, and I also do tattoo removals frequently. Quick skin cares with carbon peeling is also one of the treatments I do often. It's fast and effective, actually. The one thing that I have never done before is the onychomycosis treatment. I think that's because those patients do not prefer plastic surgery clinics in the first place. Okay, now let's take a closer to the device itself. When you turn on CuRAS, you will see this main screen. With the button you see in the middle, this one, you can increase or decrease the intensity of the targeting lights. And with the button on the left, you can control the airflow function. All CuRAS handpieces come with a special air function in order to protect the lens from dust during your treatments. The area in the middle, this area, shows your current treatment protocol, the chosen wavelength, the pulse mode, and the fluence of your treatments. Here in the lower part, you can change your wavelength and pulse mode of your treatments. After you choose the appropriate treatment mode for the pathology, you can adjust your energy and frequency settings from here. Of course, it is impossible to know which treatment mode or setting to use for a beginner. It takes time to master on the treatment modes and settings. Even I get confused time to time. But there is a load button at the top of the screen, and when you press that, you will find these saved presets for various kinds of pathologies. This makes experienced users to use the device safely and easily. When you become more experienced, you will start to make changes at the parameters to get even greater results. And CuRAS also lets you save your personal treatment protocols into the device when you get more experienced. So how do I do my treatments? I do pigmented lesion treatments mostly with no anesthesia at all. Sometimes I do the treatments under topical analgesia only when the patient wants me to do, because it's almost painless. The most important part is the planning of the treatments. I never make a treatment plan in my initial meeting. At our first meeting with the patient, I explain the process to the patient first. After I take the photographs, I make a partial treatment of the lesion for free to see the response to my treatment settings. And at our second meeting, I check my results of the previous partial treatment and plan my treatment afterwards. By doing so, I make the patient feel more confident in me and my treatments. And about sessions, I will explain later in details. I treat lesions bigger than 1 centimeter in staged treatments for patient safety. I will explain on a patient later. Here's a treatment video. I used topical anesthetic cream for demonstration only with this patient. We apply this numbing cream to the lesion and wait around 20 minutes for the effects. After waiting 20 minutes and removing the topical anesthetic, we may undergo the treatment with specific settings to our lesion. The area you treated will get hyperemic immediately after the treatment and will become hyperpigmented. This hyperpigmentation then becomes a thin crust after 24 hours, and this crust will stay on the treated area up to 10 to 15 days. As you can see, the treatment is not painful, the patient is very comfortable. And by the way, after the crusts fall off, every patient had a mild hyperemia phase in every patient. It will last a few days. I will show you in photos. This is the day after tomorrow, the day after treatments. The treatment times depends on the size of the lesion, of course. Small lesions take seconds, but bigger lesions takes 1 to 2 minutes to treat. Sunscreen is a must with these treatments, and patients have to use a sunscreen 3 times per day at least for 1 month. Here's the patient from the second video. Actually, he is my mentor. He had these multiple solar spots on his face. We treated the red circle areas. The next photo is immediately after treatment. As you can see, these are all hyperpigmented. Those hyperpigmentations will become thin crusts in 24 hours. And just after 10 days, as you can see, no residual erythema or scars. Let's take a closer look. We treated this big lesion, this one, perfectly. No hypopigmentation or residual hyperpigmentation. A similar patient with a single hyperpigmented lesion on her right malar area before and 10 days after. But there's a difference in these patients. When you look closer, I don't know if you can see, there's a little hyperemia behind the crust. This is a phase that we see in every patient, which will last a few days. And this is the patient from the first video. He is my nurse, actually. He had a congenital pigmented lesion on his right temporal area. He had an unsuccessful treatment with fractional carbon dioxide laser before he came to me, I did a single session treatment with CuRAS. These are before and 6 months after treatment photos. The oblique view of the patient, a great result, single session. And even after 2.5 years, no recurrence or any other complications. By the way, sorry about this bad quality of the photo. Actually, he is serving for the army right now, so it was really hard to contact him. I was only able to get this single photo, but I think it still serves its purpose. When we look closer, we can see that the result we got is almost perfect in a single session. At this point, I want to mention an important issue about treatments of large lesions like this one. I prefer doing staged treatments to those lesions because I'm afraid of post-inflammatory hyperpigmentation risk. If PIH occurs, I never seen before, by the way, after I treat a large lesion like this one in a single session, it will be a disaster, having a big PIH. But if it occurs after a staged treatment, the damage will be limited, very limited. For example, for this gentleman, I divided the treatment into 4 stages. I mean, I scanned the entire lesion once, but at 4 different visits. Yes, the treatment took more time, but we are doctors and the safety of our patients should be our priority. This patient also had a hyperpigmented lesion in the right perinasal area. The result is after 10 days. Closer look from the frontal view. The oblique view. Satisfaction rate is very high in this group of patients. And this patient is a good example. As you can see, there's still a little hyperpigmented area here at the cranial side of the lesion. I recommended to do a second treatment, but the patient said that she doesn't need any further treatment. She is happy with herself the way it is now. Another patient, actually she's one of the first patients with CuRAS. These are the treated areas. Please focus on this lesion on the left malar area. When you look closely, nothing at all. Treated perfectly. No residual hypo or hyperpigmentations. This was a hard case actually because she was living in the southern part of Turkey, which is almost sunny every day of the year. She has serious sun damage in her skin alongside with those pigmented lesions. I treated the pigmented lesions on her nose and the frontal area. We got very satisfactory result actually, only single treatment. As you can see, the nasal pigmented lesion treated perfectly. It's erased like an eraser with an eraser. Different story on the frontal area actually. I'm not very satisfied with my result, but the patient was satisfied, so she didn't want a second session. And hands, of course. Like our face, one of the most sun-exposed areas in our body is our hands. That's why our hands age fast too, and we see pigmented lesions on our hands frequently. This is a patient, and 2 months after. Single session, very good results. Okay, let's talk about another topic, tattoo removals. Tattoos are also pigmented lesions of the skin. That's why we have similar treatments. But the partial treatment that I mentioned in previous slides is not optional in these patients, and I think it's my opinion. Why trial treatment first? Because unlike the treatment of natural pigmented lesions, there are some factors affecting the success of the tattoo removal process. For example, the Technique of the tattoo artist is definitely an important factor. If the depth of the tattoo is not standard, the number of treatments needed might increase, and some colors, especially red, are more resistant to treatments. And depending on the metals used in the paints, it may not be possible to remove some tattoos completely. Here's a short video. This is my first consultation with the patient. We are going to do the trial treatments. I put a topical anesthetic and cover it with a tegaderm and keep it that way for 20 minutes before starting to my treatment. After 20 minutes, I remove the tegaderm and clean the area and start my treatment with appropriate settings. I'm going to do my treatment slowly with this patient because she was so afraid of the pain, so I was talking to her the whole time. As you can see, we're going to start our treatment. After the treatment, I put a topical antibiotic to the treated area, and afterwards I cover this area with a dressing. Patients remove their dressings 24 hours after the treatment by themselves and keep using that topical antibiotic for a couple of days. As we all aware of, tattoo removal process is actually painful. It can be tolerated without anesthesia in small areas, but topical anesthesia is necessary in large tattoos. The treatment time, of course, depends on the size of the tattoo. When you treat a tattoo, the colors on the treated area gets even darker after 5 minutes. And they become also crusts after 24 hours. And those crusts will last longer, around 10 to 15, 20 days. Here's a patient with colored tattoo, which is one of the hardest tattoos to remove completely. She had 4 sessions of treatment at a different clinic before coming to my clinic and was not satisfied with the progress. When you try to remove a tattoo, you have to be patient to achieve a good result. If you don't get the result you want in first 1 or 2 sessions, do not increase the energy of the laser rapidly to achieve better results. You might end up with hypopigmentations. Instead, use similar settings and do more treatment sessions. As you can see, the result I got after first session was quite bad. I can't see any difference actually. But patients, after my second treatment with the similar doses, acceptable progress after the second one, but still not good enough. But after the third session, we're starting to see some good progress. And after the fourth session, always similar settings, the result we got is quite good. Looking at the images like this side by side allows us to see our progress better. As you can see, by treating with patients, we got a good result with no complications. Here's a similar patient, similar story, had unsuccessful treatment at another clinic. It's a dark colored tattoo, so it's easier to remove actually. This is our result after first treatment, after second treatment, after third and fourth treatment. As you can see, we got good results in every treatment. Maybe one more session to remove it completely. Let's look at the pictures side by side again to have a better understanding about the progress. You can create exceptional results with CuRAS. Okay, another topic, carbon peeling. I do carbon peeling for 2 main indications, for reduction of the pores and the quick skin care. When doing carbon peeling, you apply the carbon cream to the face. You fill the pores with black pigments. Treating these areas with CuRAS afterwards causes tiny explosions of those black pigments in the pores, and the heat created by that explosions results in reduced pore size. This is the pore reduction. And to achieve significant results with those enlarged pores, you have to do multiple sessions. And about skincare, patients get softer and smoother feeling on the treated area for a couple of days. Here's a video. This application also does not require any anesthesia. You start by cleaning the face and putting this carbon cream evenly to the whole face. The frontal area, malar area, the nose, the chin, the neck, wherever you want. After you did that, you go and open your device. In the main screen, you press load and choose the appropriate setting for your treatment. In this case, we are going to choose FR1064 soft peel 1, and you can change your frequency or energy level from this screen. Afterwards, oh, by the way, you have to buy a smoke evacuator with this one because it's very smoky. Afterwards, we start our treatments. As you can see, the patient is very comfortable, not pain at all. This whole process takes about 6 to 8 minutes, depending on the area. There is no downtime after application. Some hyperemia may occur in patients with sensitive skin, but that also resolves after 10 minutes. And there is no need for special care after the treatments. One thing I do in every patient is this: I do extra passes all over the face for a little bit tightening effects. And also, never forget to clean the patient's face after your treatment, because there's always a lot of residual carbon cream, carbon dust. And I think it's the last part of my presentation, hair bleaching. Hair bleaching is a minor but very useful indication of CuRAS, and it's a good option for the ladies with dark hairs on the sideburn area. The same principle: we turn on the device, push the load button, choose the appropriate setting for ourselves. In this, we see the effect immediately during the treatment. As you can see, while I treat, this is my arm actually, the hairs get white. The whitened hairs stays white for weeks to months. And even some of the hairs will come off, like it's an epilation or something, but they eventually, of course, grow back. So for stable results, the treatment should be done every 4 to 6 months for good results. This is B, immediately after treatment and 5 days after the treatment, and I know for myself it will last months for me. So this concludes my presentation. Thank you for your attention. Let's look at the questions now.